Let's look at the diagnosis of cerebral palsy. How can you diagnose cerebral palsy? One, we need to do blood tests, and these blood tests are useful in ruling out conditions and also infections. So if we have done blood tests, we can rule out any infection that can be present. Also, CSF test, cerebrospinal fluid test, we can do a test to rule out infection as well in the brain. We also need to do imaging tests like MRI and CT scans to rule out any brain abnormality. Yeah, we need imaging tests like MRI and CT scans to rule out any brain abnormality. If we suspect the baby, if we suspect the baby has convulsions or seizures, we can do what we call electroencephalogram, the EEG test, to rule out seizures. We also need to do developmental monitoring. Monitor the developmental milestones of your baby. As your baby started crawling, as your baby started rolling over, as your baby started sitting, walking, jumping, and all that, talking, speaking, that is developmental monitoring. So those are some of the ways that we can do to rule out or to diagnose cerebral palsy, the CP. So I want us to look at the treatment. As I said, these are permanent. The movement disorders are permanent, and therefore they cannot be reversed. They are irreversible. So the treatment, the CP treatment, as in, what do I mean? CP cannot be cured. Cerebral palsy cannot be cured. But the treatment options that we have are aimed at improving the quality of life. In other words, the treatment options that are available are aimed at improving the quality of life by managing the symptoms. So what are some of the treatment options? We have speech and language therapy. The baby can undergo some therapy in terms of speech and language, wherever the baby can be trained on how to speak. Yeah, that is therapy. We can also have physiotherapy. That is the physical therapy. You can stretch the arms, you can try to lift the baby, unamwonyesha kutembea, unamuinua. These are some of the physiotherapy, the physical therapy. This can improve skills, motor skills like walking, jumping, crawling. So the physical therapy. We can also do occupational therapy. Occupational, this will equip the child with everyday skills, maybe drinking from a cup, holding the cup for himself or herself, cooking. Yeah, the everyday skills. This is occupational therapy. We can also give these babies assistive devices, maybe wheelchairs, hearing aids, the walkers. These are the assistive devices to assist them. If it is hearing eyesight problems, maybe glasses, specs, hearing aids, these are some of the assistive devices. So we can also do surgical interventions. So if we have conditions like scoliosis, any damage, any hip joint dislocation, we can do surgical maneuvers to correct an abnormality. We can also do now the medication to manage the symptoms like the muscle spasticity, the stiffness. We can have medication like baclofen or Botox injections. These are some of the medications that can be given to correct cerebral palsy. Now, what about the prevention? The prevention, number one, we have the maternal health education. Every pregnant woman, every pregnant mother should be educated on the risk factors. Like avoid this and this, take this and this, because if you don't do this and this, you are increasing the risk of having a baby with cerebral palsy. Not only cerebral palsy, but other conditions. So number one, all the mothers should be aware of the risk factors. Number two, if the mother has any underlying condition like high blood pressure, preeclampsia, any disorder, the mother should be controlled, should be treated. any maternal condition should be managed. At the same time, you manage any, one of the maternal conditions is stroke. You prevent maternal stroke by controlling the pressure, monitoring the blood pressure, and also the fetal stroke. The other thing is avoiding birth complications. Avoiding birth complications. And this is whereby we use safe delivery practices. Any delivery should be conducted by a qualified, a skilled healthcare provider so that we can have safe delivery. If it is episiotomy, it should be done by someone with the skill to avoid head damage. Another thing is monitoring fetal distress. When the woman is pregnant, the pregnancy, the labor should be monitored. If the baby is distressed, if the baby has swallowed what we call the meconium, the meconium stained liquor, MSL, you should monitor if the baby is in distress. The other thing is preventing preventing head injury after birth. Make sure that the delivery is safe. Make sure the head is safeguarded. You protect the head as much as possible because head damage can lead to brain damage. Another thing is controlling infections like the rubella, get vaccinations. The jaundice should be managed, and so on. Another prevention is preventing premature birth. There are so many risk factors that increase the risk of giving birth to a premature baby. So the pressure of the mother should be monitored closely during the labor. All those visits should ensure, the labor is monitored very closely. Take vital signs. How is the pressure? Is it fluctuating? How is it? How are the BPs? It's very important because this can prevent premature birth. Another factor is infection control. Infection control and maternal infections. So if, for example, we said cytomegalovirus, CMV, it's an infection that can cause cerebral palsy, it should be managed. Get vaccination against rubella, the German measles. These are very key. They are very vital. And lastly, about prevention, we can have regular prenatal checkups. Prenatal care. In prenatal care is where we will give vaccinations. The mother will be vaccinated. Like the child will be, yes. The prenatal care will ensure there are vaccinations, CMV, rubella, and all that. During the prenatal care, we'll have regular checkups, checking vital signs, checking the normals and the abnormals. The other thing about prenatal care is healthy lifestyle. Avoid drugs, avoid alcohol, avoid cigarettes. Another thing is proper nutrition, balanced diet, eat well. And the other thing is managing chronic conditions. If the mother has chronic conditions like diabetes, hypertension, all those ones are very key. So it's very important to ensure prenatal care. Go for regular checkups, eat well, balanced diet, avoid drugs, avoid alcohol, proper nutrition, vaccinations, etc., etc. So it's very important that you do what is important, what is necessary to prevent cerebral palsy. Remember, once the cerebral palsy has occurred, it is permanent. Your baby will live with that condition, movement problems. So we may have other preventive measures, but that is little about cerebral palsy. In case you have a question, kindly ask me, I will clarify. Maybe I have done it in a hurry. I should have done details, maybe because I have also not discussed the types. There is a lot about cerebral palsy, so this is just an overview. And as I said, I thought it is good if I join the world in creating health awareness, because my initiative, Mtumishi Ishmael Volunteer Health Talks, takes delight in creating awareness. So kindly allow me reach there. This is the little that I had. May God bless you. See you in my next video.